So let's dive in, Sheila, and I just want to start by asking you, what makes this so annoyingly stressful, in my opinion? If you had to sum it up, how would you do that?
Well, I think that so many of us are intimidated by the medical field, especially doctors. It can seem like such a formal process, and I think we have this idea that it's them and us, and we're two separate things, and they know their thing, and we're just going to have to follow their path. And what I would really love people to take away from today is that you can take some agency, you could take some control, and you start off by thinking about what is important to you, what is valuable to you, what is most important to you and your loved one. And if you frame everything that you're doing in that conversation with this basic, this is what I need, this is how I like to work, how I like to proceed, it's going to help counterbalance any fear that you might have, and it's also going to help with some of these questions we're going to talk about. So just wanted to kind of lay that out as a framework. Know what you want, know what's important to you.
Yeah. So I like that, and I would go in I agree with all of that, of course. I would also sort of take it slightly in another direction. So, and we're sort of doing a couple of things in this conversation. One, we're talking about sort of how we can manage the stress or anxiety that might come with just communicating with with, with the doctor and medical teams, etc. And then we're also talking about it with maybe a bit more of a narrow scope with like doing that in the wake of a new diagnosis, right? And of course, being diagnosed with anything can be scary and uncertain and name the emotional response, right, to getting a diagnosis.
Yeah.
So that other side of it is I just add that to what you said and sort of like almost to as a prompt to hopefully get people in the conversation today to sort of like add that to what you were suggesting around knowing what you want and that might be comfort, it might be having your questions answered, it might be guidance to what steps you need to take and help
Right.
taking them, right? But it all
Right.
comes back to what you were saying around actually finding your voice and being able to communicate that. So
Mhm.
and it's easy for us to talk about, it's not as easy to do it when you're in the midst of it, which is why we're talking about it. So full circle moment there. And just a couple of things I would throw out that I want to get your take on, Sheila. One is, and this was advice given to me when I was caregiving, and it helped me. It wasn't like a magic wand by any stretch, but it helped me because I got really intimidated by the notion of talking to doctors, particularly my mom's neurologist. And like the fact of the matter is, I'm not a neurologist. I'm not a medical professional of any kind. I don't have their training. They're years and years, decades in some cases of training. But I know my mom. I knew my mom, this
Mhm.
example, better than any of them did,
Yeah.
right? And I was seeing her more often. Like I was truly that front line, right? So it was the advice that I'm referring to was like I had more than one person like trying to help me not lose sight of that, right? As I was preparing
Huge.
for appointments and but also as I was in them and having that conversation. Like those are important, very, very, very important. In fact, I would say make me if we think about like the ecosystem of people helping up the person you're caring for. In my case, my mom. There was the doctor, the nurses, etc. My role was just as important as theirs, right?
Yeah.
So like this notion of just understanding that and actually believing it.
Yeah.
What's your take on that?
Absolutely, and I think it goes back to a little bit what I was talking about earlier is and this also goes for you going to your own doctor for you, right? So you're living in this body, you've had this life, you have this lifestyle, and they have medical experience, right? So they've got medical experience, you have mad experience, and those 2 have to come together and meet in the middle. So the things that are important to you have to match up with what they're suggesting or what they're saying is happening, and you also don't be afraid to question that. Well, I know that typically would happen. That's not how it's feeling for me. Like this conversation, this back and forth is so important. And I think some ways to get over the initial intimidation, make sure you prepared for an appointment. I always write down Like, what is the one thing that I absolutely want answered before I leave today? And I write it down because I'll forget. I'll get caught up in another thing. Sometimes it's 1 to 3 things, and it could be if you're caring for someone, you've noticed some new symptoms or behaviors, or you want to discuss test results. Whatever it is that you think is the most important thing to get out, write it down so you have it with you. So there's this sort of practical steps you could do for that. And then I think the other thing is the mental prep. All right, we're going to go in. He's an expert in his area. I'm an expert in mine. And we might be talking about some sensitive things. There are things that I might not understand, but we're talking about another human being. We're going to have a conversation and get to a middle ground where we can both understand.
Yeah, I'm glad you brought up preparing. It's like we've done this together before because that was my next going to be my next question. And I could not agree more with your suggestion of writing things down. And it doesn't have to be like fancy. It doesn't have to be. It could be what it could be on a napkin for all I care. But if you're writing down the questions, hugely important. So totally agree on that, Sheila. I would also like it helped me, and I'm like when I was in school, I'd studying for tests, I would always write it down. So maybe I biased toward this, but it helped me feel more confident because I knew
Yeah.
I had paused, even if it was for 90 seconds to write a few things down. I knew I had that going in. So definitely the questions that I wanted to get answers to, but also, and this wasn't easy for me, but like how I was feeling, right? And like they're not all of those things weren't maybe suited to be addressed in front of my mom. Most of them were, but not all of them. But
Right.
writing them down was really helpful to me. So then I had like, like there were a few points when I was just really scared. Lots of points, but few where it was
Sure.
like it was very acute. I was really fearful of the next shoe to drop and like, man, I don't know how I'm gonna do this. So writing those things down to actually and like just be able to refer to it and like nudge me to mention it while we're
Yeah.
in the meeting was helpful.
Mhm.
But and it like I guess the other thing I would say is if you haven't gotten prepped like this before, conversations with doctors, like just try it. And it doesn't have to be like even if it's one or two things. And the more you do it, the more habitual it could become, is what I would say.
And I think just this last point on here, Matt, is you mentioned the word confidence. And I think this really helps you to balance this. I see a lot of people who go to the doctor and they just melt into this sort of compliance and they're going to tell me what I do. And I have no recourse but to follow something
Right. Right.
exactly. And this sort of gives you the opportunity to say, wait a minute, I have a question about that and talk it through. It does build your confidence. But you need to take the action in order to build your confidence. A lot of
Hmm.
people say, "Well, as soon as I get confident, I'll be able to do that." It's kind of
Yeah,
the other
right.
way around.
Right. Yeah. There are things we can be doing. I love that point. Things we can be doing to actually help ourselves build that confidence.
Yes.
I really like that. And such a good analogy you dropped with, like, and you used the word agency a few minutes ago, but I sort of think of it our own having our own agency and confidence is sort of tethered together. But like, it's so good. You're like, they're so true when it can be really easy to just, you get into the doctor's appointment or medical appointment, and it's like almost like you're stepping into a river and just going with the current.
Yeah.
And yeah, generally speaking, like it's safe to assume the current's going to take us in the generally right direction, but we have the ability to sort of steer and stop and
Yes.
like be in full control. This is
Navigate.
yeah,
Yeah.
exactly, exactly. Okay, so and I see we have Tiffany in the back helping us out, and she's sharing some information. That's a gifted piece of content from the Carallel app. If you click on that, you'll be able to see the article straight away. And then if you want to do more stuff, you'll be prompted to sign into the app, which is super easy to do, or sign up for the app. But thank you for that, Tiffany. So Sheila, let's dive into some questions. All right.
Mm.
And we can sort of rapid fire on these. But these are questions, we sort of have two buckets of questions here. One is for sort of general practitioners, primary care, doctors and teams. And then we have some additional questions that are maybe a bit more tailored to conversations you might be having with specialists.
Right.
Um, so what like the first question we had on our list is like, and some of these, I guess, caveat, some of these sound obvious, right? But they're not. Write them down. Like these are everyday important things, right? For you to know as a caregiver, for the person you're caring for to know, etc. So I would just like write them down. And all of these questions, by the way, or most of them anyway, are in the resource that Tiffany just shared. But will you stay involved even if other doctors are involved? So this is a question you're asking to the primary care physician. Like, so simple, but important for you to know, right?
Yeah. Yeah. And don't take yes for an answer. So if they say, yeah, I will, what does that mean? How will that work? Are you going to be the central source of information for me to get in touch with you? How will everything work? And how do you work with these doctors? And so it just leads to more conversation and goes a little bit deeper than, are you going to be here if I'm working with another doctor? Well, tell me more about that.
Right. And yes, I'm really glad to hear you say that around sort of, and I forget actually the exact words you use, but don't be afraid to dig deeper. And this will be a recurring theme as we jump through these. And I would also say, when you ask the question, it's important for us to be obviously listening to what we're hearing, what they're saying verbally in response, but how are they saying it? What's their tone? What's their body language? Like
Hmm.
there are, I don't mean to make it sound like work, but when we ask a question of someone, there's more to the answer than what's being spoken, I guess is
Yeah.
the point, right?
Yeah. And if
And
you
and
say, tell me more, you're going to get more information and you're going to require that they think it through about how to respond to you. So tell me more about how you stay involved. Well, I talk with this doctor and then I'll do this. And then you have this framework. You have an idea of how the system works. You could put these pieces together.
yeah, and open-ended questions, yes, absolutely. And don't be afraid to. I was a notorious note taker in these appointments, so I was writing everything down I could. But another good question is, how does your team work and communicate with other specialists, right? So
Hmm.
this is, this is a question about, it's a logistical question, really.
Yeah.
But we've all been there ourselves in the healthcare system. You get sort of sucked into the vortex and you got lots of different people involved. But a question like this is, again, to your point, Sheila, putting the onus on your primary care in this case to help you understand what that actually looks like, right?
Yeah. Yeah.
Practice.
Are they on the same computer system? Do they talk routinely or only when something comes up? You know, so just really get a sense of how do they talk to each other? How do they communicate? Are they seeing each other's notes in a computer? And is it a normal cadence or only when something specific comes up?
Yeah. And then so on the other side of the communication coin, there's like a very valid question of how I, Mr. Caregiver, or like how should I be communicating with you? Right? Is it the
Hmm.
other side of uh, that question? Is it
Yeah.
email? Should I be doing it in the portal? Well, maybe not everybody's comfortable using the portal. And so very, very valid question there around you know, how they would suggest you get in touch with them.
Yeah, and even to the details of if they say, just call the office. Well, who do I talk to? Do you have a specific nurse who works with you? What's that nurse's name? So we're getting really down to the nitty gritty, and you're going to keep these things handy so that when you call in, you say, hi, this is who I am. I'm calling about this patient. Here's the date of birth, and I would like to speak with Jane.
I love it. I love it so much. And we're going to keep sort of hammering this point, but because I have vivid memories of at times wanting to ask questions, and maybe the appointment was running long, or maybe I had already asked a lot of questions. But if I could go back and tell myself that was myself at that point, I would say, keep asking the questions. If it's in your head and you don't have absolute clarity, ask the question.
Right.
Keep doing it. It can feel funny sometimes, maybe like I remember feeling like a burden sometimes, like I don't want to annoy Dr. Such and such. Like ask the question if it's on your mind, because having this clear picture, uh, it not only gives you the information you need and what you're looking for to do best by the person that you're caring for, but there's an element of peace of mind that comes with this for you, for
Yeah.
us as the caregiver. And related to your point, Sheila, We have another question on this list, like how should I share information if I notice changes in my loved one? What if they're
Hmm.
exhibiting different behaviors or new symptoms pop up? Like what should I do? Who should
Right.
I call? To your point about getting the name, being able to say, call the office and say, hey, this is so and so. I'm calling about my mom. Here's the identifiable information. I'd like to speak with Jane in your example. Like getting the information to be able to do that is great. And maybe, yeah, of course, Jane's not going to be available every second, but it's just you're taking the onus to put a finer point on things from the start.
And
They
it
say
comes off as confident to the person answering the phone.
absolutely, and there's value in that. There is
Yeah.
value in that because that can, maybe not always, but that can also influence, let's say, for lack of a better term, the level of customer service you're getting from this doctor and this medical team, right? Okay. So,
Oh, I
uh,
want to say one more thing about this, Matt, because I think it's important not only, how you should share this information, but dig a little deeper here too and say, what kind of information is important to share with you? And then I even want to go more and say, what words am I going to use? If I want to get your attention, I'm probably going to use words like sudden or new or worsening or severe, or I need this immediate attention, or give specific numbers. The blood pressure is this. The blood sugar is this. Think about somebody answering the phone. You want to get their attention. So
mhm.
think of those words that are going to make an impact.
Yeah, I love it. And this is, that ties in, Sheila, to sort of a recurring theme in many of these conversations that we have, but just around being specific, right? Like
Mhm.
we've talked often about just the notion of documenting what we're seeing, what we're observing in our loved one, right? So, just imagine a scenario when you're doing that. And again, it doesn't have to be fancy. You could have a running notepad on the kitchen counter and say, after dinner time showing this or that, but like, increased blood pressure, whatever it is, like as many of those specifics as you can use in calling. So there's like this element of like words you're using, but also just generally speaking, like being as specific as you can when you're communicating in this case
Right,
to the doctor's team.
right.
Because I think that also accomplishes what you're getting at there.
I
Um,
think you're right. And that is important. You don't just say, well, they're kind of off today. That's too
right,
vague. You have to say they're noticing some tightness in their chest. It's
right.
specific.
Yes. Yep, absolutely. Just a quick plug. We're cranking through these. Would love to hear from you. We have about 8 minutes left. QA button down on the bottom of your console. Feel free to chime in with questions. We'd love to get to those. Couple more for the general practitioners. This is a good one. So understanding, and we sort of touch on this theme occasionally, but understanding who the other players are, right? Understanding, getting a broader view for who the team is, quote unquote.
Mhm.
So, what other members of your team will be involved, will be working with you? Are the social workers involved, pharmacists, like who are they? Getting as much of that information in some detail, like if not, yes, this our social worker is Rachel and
Mhm.
she'll be helping. Just getting that information. Oh, okay, what's Rachel's email or what's her phone number? Just as much as you can dig up there. Again, these are not only opportunities for you to get information that can be helpful and comforting to you, but also just information, like the exercise of doing it can help you, right? It can feed your sense of agency, help you build your confidence because you're taking action. This is what,
Yeah.
by approaching a conversation like this, you're taking action.
Yeah. Yep. There are so many unknowns. And what we're trying to do is fill in some of those unknowns with things that you could count on. And
Yeah.
this is exactly the point.
Exactly, exactly. So, okay, let's dive into the specialist. And again, we're sort of kind of tying back to sort of like having these conversations in the context of a recent diagnosis. Okay,
Mhm.
um, so and this would likely be to a specialist, but maybe not just a specialist. But what does the condition look like over time? And like,
Yeah.
what are we looking at? Again, seems like an obvious question, but it's a crucial one to ask and for you to get an answer to and understand. Have a as good an understanding of the answer as you can.
Yeah. And I've seen so many caregivers who don't do this and don't really have a sense of what to expect. And if you don't know what to expect, you can't prepare. And it's so important. So many things take time. So if you're going to be changing medications, or you're going to be needing more help, or you're going to be needing some medical equipment in the future, it's nice to have that time to prepare for that. And if you have a sense of what to expect, that's what helps you. And it is peace of mind. It gives you the time to plan these things out.
Love it. I love it. Couldn't agree more. Related to that, what are our treatment options? Right? Maybe seems like an obvious question, but I guess I would extend this one a little bit to, and every professional is different, right? And
Mhm.
every situation is different. So of course there could be times when, there is just one path for treatment, right? But I would just emphasize the options. Like the
Right,
operative word in that question is options. What
right.
are they, right? And yes, of course, I'm going to weigh Mr. or Mrs. Specialist. I'm going to weigh your opinion heavily. Of course I am. But I want to know what the full picture of options looks like,
Yeah.
right?
And sometimes that takes some digging too, because I think depending on where people trained or what their experience is, they tend to go down one path. So what I would say is, are there any other options? And if I weren't a candidate for this, what else would you do for me?
Mhm.
That sort of has them go in a different direction that's not really typical. I also ask often, if this were your personal decision, what would you do? And then you could even go into deeper as you're looking at the different treatment options. How are you gonna measure if it's working? And what are you gonna do if it doesn't work? Like, what's the next step? And where do we go from there? Once again, you're planning your expectations. You're planning what might happen down the line. So you can have a big picture and get a sense of the way you're going, and you might need to shift gears at some point, and that's okay because 'cause you've got a plan B. It is peace of mind.
Mhm. Yeah, absolutely. And also, they may not have answers to all of these questions in the moment, but again, you're you're sort of setting an expectation with this professional that this is what you're looking for, what you need. You have an appetite for this information. There's an element of tone setting to this, I guess is my point. That
Mhm.
again is an added ancillary benefit. Where can I learn more about this diagnosis? Which is
Yeah,
another
great
really, really
question.
important question. And of course, if you have access to Carallel, that's
That's right.
these are all things we can help you with. But
Yeah.
this is about equipping caregivers in the moment when they're talking to doctors, getting prepared to talk to doctors, etc., etc. So this next question is a big and heavy question, but I think it's important, and it is like, are we closer to the beginning or the end of
Of the
this condition,
disease.
or
Yeah. Yeah, it's
um
so important for planning and also mental. Preparing yourself mentally, emotionally, not only the logistics of caring for someone, but is it ready for me to make a shift in, what happens when or if or and what happens next? And it's really so much more beneficial to know rather than to be blindsided, right? And to
yeah.
be, oh my gosh, I didn't see this coming. I love the way it's phrased too. Are we closer to the beginning or to the end? It's not a stage, it's not saying definitively, but kind of where are we in this process?
Yeah, and so I like that also, and I like it for a different reason. Just my personality, a similar reason, but slightly different angle. Questions like this scare me personally because there's a part of me that, for whatever reason, we all have our stuff, right? And there's,
Mhm.
you know,
Yeah, for sure.
there's a part of me that is like, oh man, do I want to know,
Yeah.
right? But there's a bigger part of me that knows I should, for all the
Mhm.
reasons you're describing. So for that reason, I love the way this question is phrased, right? It's
Mhm.
open. It promotes sort of. I mean, technically, they could give a 1 or 2 word answer, but I think the way it's set up lends itself to a more telling answer that you'd get
Right.
from the person that you're asking the question. What signs might we see? What signs might mean we're shifting to a new stage of the disease or the condition?
Mhm. That's a great question to ask because then you can start keeping an eye out for those signs. You can
Yeah.
start paying attention to behaviors or symptoms or anything that comes out that might indicate you're moving to a different stage. And if you don't have that basis, you won't know what to look for. And I'm going to go back to something we say a lot is to write it down when you see it. There was this day at this time, I noticed this, and stick it
Yeah.
on your fridge or stick it somewhere that you'll take it to your next doctor's appointment. Really helps them out a lot.
Agreed. And I've done a poor job of managing the clock today. We're out of time, so
Mhm.
we're just going to move to wrap up. Again, just the links that you see in the chat. If you click on the chat, um, you have a couple of articles that have all of these questions, um, and then one article that has all of these questions, and one article that lays out sort of steps you can take after a diagnosis. So definitely click on those and save them in your web browser. They're short reads, but packed with a lot of great information. Sheila, what would your final thoughts be to the group on this topic?
Everything we've said, Matt, it is, I would definitely take a notebook. I would write down the thing you want to walk away, from that appointment. You absolutely want to know this one thing or two things. Focus on what's important to you, and dig deep. Ask the questions, dig deeper, and so you can gather as much information that you possibly can. It's going to help you. It's going to help your loved one. Everyone benefits.
I agree completely. I would just say everything that Sheila just said, but also remember, no one knows your loved one like you do. You are on equal footing. If you look at if all the people in the room, from the medical team to you to your loved one, when your loved one's at the center, your role is just as important as the doctors, the specialists, the nurses, and I'd argue more important in a lot of cases. So, if I could go back and tell my earlier caregiving self, I would. That's what I would tell myself, and
Yeah.
I would also say act accordingly, right? So instead of being intimidated, I know it's much easier to say than to do, but that would be my take. So thank you, Sheila. Thank you, Tiffany in the back, and thanks most importantly for everybody being here. We'll see you
Take
next
good
month.
care. Bye
Bye
bye.
now.